When we talk about how a disease progresses in a certain country or an area, we talk about three factors. One is the agent, host, and environment. Coming to the agent factor, we all know coronavirus is a novel viral disease. That means new. It is a zoonotic disease. That means it has jumped in this case from bats to humans. When it is new, there is no defense among us because there is no memory. And if you look at the virus in itself, there are two variants, S type and L type. L type is the aggressive type. That is about the agent. About the host. Host is our humans. In this context, how Indians are. Immunity is what we always talk about. If you look at that, elderly people are more at risk. Younger people may show lesser symptoms, but they are the one who will carry it and spread it to others, either carrying a milder disease or becoming an asymptomatic carriers. If you put these two things, Italy has 22% elderly population, whereas we have about 6.5% elderly population. Various studies have also demonstrated that the natural killer cells, which give certain type of immunity, is much better in Indians, and it acts as a stronger defense mechanism for us. And undoubtedly, we Indians are exposed to many more pathogens than any other Westerners. So that should be reassuring that hopefully our defense will take care of it to a larger extent. Coming to the environmental factors, we are in a hotter climate and the hottest part of the season, and hopefully that would be a blessing. If you look at the global map, the spread of this COVID infection is along a narrow corridor of latitude 30 to 50 degrees north, wherein the temperature is about 5 to 11 degrees Celsius and humidity about 45 to 80%. A study in China has shown that the virus transmission is best at around a temperature of 8 to 9 degrees. So we are much hotter than that. And interestingly, malaria endemic areas are spared with this disease. And we all know we always take this BCG vaccine very religiously. These BCG vaccines are enhanced T-cell mediated immunity and stimulates our innate immunity, and various studies and reviews are showing that it could be protective against many of the viral infections, including this, to up to about 30%. There is an interesting study outcome which has come that the version of virus what we have is slightly mutated version due to some microRNA changes. So that could also help us. So in a nutshell, the hotter temperature, humidity, younger population, many of us take BCG vaccine, malaria endemicity, and a mutated virus could all help us. And please do not underestimate the measures taken by the government, the people's participation. Some places, of course, it is lacking, and essential service providers' dedication. These three things also are equally important. Having said that, we would wait and watch and keep our fingers crossed. After looking at all these things, I get a feeling like Darwin famously said that survival of the fittest. So when the virus gets mutated, that's what it used to strike me, that maybe the virus is trying to survive. But more importantly, he also has said one more quote, that the species which would survive is neither the strongest nor the most intelligent, but the one which is most adaptive to changes. Jai Hind. Hope we win this battle. Our Prime Minister has compared this to a world war-like situation. I hope we get enough resources to face this war. I hope we get support from the public and the politicians, stakeholders. And I would like to applaud all the essential healthcare providers, not just the doctors, nurses, people who are working in the hospitals like lift operators, drivers, and IMRs who help us, grocery shops, police, military, paramilitary forces. Big salute to you all. Jai Hind.